Welcome back. Today we're going to talk about formulary decision makers. In previous Managed Markets Mondays from Palio, we've talked a lot about how to market to folks in the payer space. And we keep referring to these people that are called formulary decision makers. And I'd like to think that, or I'd like to claim that I invented that expression, but unfortunately I didn't. It actually comes right out of FDAMA 114. But then becomes the issue of defining who is a formulary decision maker, who are your target customers within the payer space. It's very complicated. And we talked before about there's generalists within the payer space of folks that want very, very high level, succinct information. There's folks that are very cost centric and other folks that are very medical centric and so on. We'll talk about each of them in a minute. But suffice it to say that it's complicated. There's a lot of folks there that your marketing has to address, and it's very different than your healthcare professional marketing. HCP marketing, you have one target generally. It's a doctor. You're trying to convince this person to take some action, to prescribe, to identify a patient that'll benefit from the drug and prescribe it for them. Formulary decision makers have a much different task to make. They have to take medical information, clinical results. They have to take economic information. They have to compare them, and they have to determine whether or not they should make a drug available for a physician to make the decision I talked about before. It's a very different decision. So let's talk about them a little bit. So when we say payers, who are we talking about? Let's exclude a couple of folks that theoretically could be in the payer space, but for our purposes will complicate things. So the government. You've got government, Medicare, all four parts, and you've got Medicaid, and you do market to those people. But generally, from a payer perspective, if you create a good value proposition and good clinical differentiation, you can get where you need to be with those folks. So let's talk about commercial payers and focus on them. So we talk about payers. The first point of contact, generally when your account manager walks in, is the pharmacy director. Frequently, many account managers don't get beyond this person, and that's by choice from the plan or just by virtue of the relationship that the account manager has. We at Palio think that you need to go deeper in the organization, especially if you're advocating for a drug that's going to take some advocacy. The no-brainer is pharmacy director. You can get in there, you could shake hands and be done with the deal. But a pharmacy director is principally, the way they evaluate their value each year is by managing the formulary. And by what I mean when I say that is, it's about delivering value, dollar value to the organization. The next point would be a medical director. A medical director is a person that's responsible for the medical product that the health insurance company is providing to their members. And so they're going to be very interested in things like clinical differentiation. How does this drug relate to no treatment first and then competitive treatments afterwards? And that person will have a voice into the pharmacy director and is a person that sits on the formulary committee to evaluate whether or not a drug is going to be admitted and then ultimately what type of access it will have. There's other folks, there's quality directors. You'll find people within the payer that are responsible for NCQA initiatives and things like that. And if your drug happens to have a HEDIS measure associated with it, that can be a point of receptivity for you within the payer. Someone that will help advocate for the brand from a different angle and from a perspective of if a drug helps them hit these quality measures, then it becomes something that person might advocate for. You have utilization managers and actuaries, and these folks are all about the beans. They count the beans, right? And it's their job to assess the impact of a particular therapy and broad classes and things like that. And their job is to understand predictability of things. And so when you talk to them, they're going to want to know things like how big, how many, how much. How big is the class currently that we're treating with this particular therapy? How many of my members or patients are going to be affected? And then ultimately, what's the per member per month bottom line impact to the plan? Another person we talk about is case managers. Now, a case manager, they're sort of the utilization management gatekeeper. Some folks confuse them with patient advocates in the physician's office, and that's not really their job, although everybody in the plan theoretically is a patient advocate. The case manager's primary job is to make sure that therapies are appropriately going to the right patients, that they're being safe in their execution, and they do offer a little bit of help with regards to access and persistent compliance and things like that. But a case manager, the way you're going to want to communicate to them is what's unique about your drug, which patients are most appropriate for that product, and then give them a little bit of information about support and things like that. Another one that formulary decision maker doesn't get considered a lot is payer opinion leaders. Now, these folks, big national plans will have physicians on staff for specific disease states or for broad ones. But for the smaller ones, the regional ones, they're going to hire physicians from the community to consult into their formulary decision process. So you can go and talk to those folks. Now this is tricky because they are prescribers. And there is a wall between what you can say, especially with regards to cost and economic impact to a payer and a formulary decision maker, that you shouldn't say to a prescriber. But we have the ability to clearly identify who the payer opinion leaders are. And then you can give some messages, economic messages to those folks to help them advise into the formulary committee. We talked a lot about health plans. Hospitals also have formulary committees, right? And so a lot of the folks, the players, are the same, probably just less removed from treatment for a while. Palio Managed Markets, we think that a really robust marketing plan for a product into the payer space will have a little something for all of these folks. We think focus your messages, say the best, most elegant story you can, and then specifically address some issues that might come up later. So that's what we're thinking about formulary decision makers. I hope it was helpful.